Let's continue with leukemia. Very interesting disease. It was discovered in 1960. It belongs to the family of the retrovirus, but this is an oncovirus because normally it will produce cancer in the cats. It is contagious and it causes secondary terminal diseases like cancer, blood disorders, and also will affect the immune system. It is transmitted from mother to fetus and also cat to cat. This is a little bit different than the FeLV. How common it is? Well, it's found worldwide and it affects all breeds of cats. Again, United States, 2 or 3% of cat population are infected with leukemia, is what the statistics say. And also, of all documented sick cats, 13%, or maybe a little bit more, they were positive for leukemia. How is it spread? Mainly by fluids from the body, like a nasal secretion, urine, feces, blood, saliva, is how they spread the disease. Most commonly transmitted by direct contact, mutual grooming, sharing of litter boxes, food and water bowls. And also, like FeLV is transmitted by bites, also is transmitted from mother to kittens and through nursing. Any questions? The good news is that leukemia, the virus does not survive many hours outside of the cat. There was one question recently, like if somebody gets in contact with blood when you are collecting blood from a positive cat, would you be able to transmit to another cat? And yes, you will. That means that we need to wash our hands every time we are handling cat like this so we don't infect another cat. What cats are at greater risk? Those fight. Cats that are living with infected cats. Cats who go outside and are not supervised. And kittens born to infected mothers. Right before I came this morning, I had a ironic leukemia positive cat that arrived to the clinic. And this lady, she knew a month ago, but besides having this cat, she's feeding a colony of 20 cats. This is something that is sad. And she was telling me, it's like, hey, I had one of the female cats that is the one that comes closer to me, and I had a schedule to be spayed like 2 months ago or something like that. They canceled my appointment, and guess what? We have new kittens now, and we don't know if the cat is positive or not. So we start talking, and the cat 2 weeks ago had an abscess in one hand. Now it has another one in the other arm. And what does that mean? That this cat is out there fighting, transmitted the disease. So they are out there. You may be in contact with people that bring cats in here. I don't know if somebody's working with the stray cats or not, but they are out there. And there is a lot of cats that are infected with these diseases. What are some of the symptoms? At the beginning of the disease, they are no symptoms. Okay, they are like a normal cats. Like what's your name? Excuse me.
Margaret.
Margaret. She said that her cat is like nothing happened. Same thing with this. At the beginning, you won't see any. Over time, it will start deteriorating and it will start affecting the health of the cat. Cats that have leukemia have a 20 times greater chance of getting cancer than those cats that are not infected. Some signs are similar to those of FeLV: loss of appetite, weight loss, enlarged lymph nodes, fever, pale gums, inflammation of the gums, bladder and upper respiratory infections, diarrhea, variety of eye conditions, and also it provokes abortion in cats that are, mother cats that are leukemia positive. Life expectancy. It is difficult to predict, but with an appropriate care, they can live up to 3 years, most of them. They will develop a secondary disease at 3 years of age, normally. Of this, 70 to 90%, they will die. There are different types of leukemia virus. Actually, there are 3 specific ones. We have the A, feline leukemia virus A, and this occurs in all cats that are infected, and this is the one that affects the immune system. The B affects 50% of the cats that are positive, and is the one that causes tumors or cancer. And the C is the less likely. Only 1% of the cats that are infected, they will develop anemia. That's another of the symptoms. There are 2 stages of the feline leukemia, and this is something that I would like you to understand and stop me if you have some questions. We have first the primary viremia, and that happens when they get the infection. Okay? These guys, 60% of them are able to clear the infection and the primary when they are in this stage. And in my next slide, you will see that 60%. And the secondary viremia is when the virus is replicated in the bone marrow, and when it gets to this point, there is no return. The cat is going to be infected for the rest of its life. There are 2 different tests that are used. Again, this is the one for the FIV, and this is for the leukemia. The first one is called the LYSA test. This is the one that normally we do in vet practice or shelters. And this test can detect the primary and the secondary stages of the disease. Okay. And we also have the IFA. It's a indirect immunofluorescent antibody test, which we call it the confirmatory test. And what does that mean? If you get a leukemia positive cat, and you may say, well, let's repeat the test again to make sure that it is a waste of money if you try to do it, because if it's positive, it's going to be positive. If you want to confirm that it's positive, you need to do this test, the IFA, and that one you send it to the lab. And this test only checks for the secondary viremia, which is when the virus is replicating in the bone marrow. Testing for feline leukemia. Kittens from the same litter, we should test all the kittens. We should not assume that by testing only one kitten, the rest of the kittens are going to be negative or positive. We need to make an effort. It may be a little costly, but for sure you will know what is going on with the litter. And a kitten, a single feline negative, does not mean that the entire litter is negative. Okay, so again, you need to test every single kitten. Some kittens get infected in the uterus, some kittens through milk or saliva, but many of them can clear the disease. Okay, so some of them will test positive, some of them will test negative, so you need to be aware of that. Important notes when testing for feline leukemia. All incoming cats and kittens should be tested. Again, don't assume that because one kitten on the litter is negative, everybody is negative, and hey, let's find home for them. No. It is not accurate to conclude that the entire litter is positive or negative based on just the mother's test. If we only test the mother and say, oh, the mother is negative, the mother may have maybe on the 16% where there is, she's clearing the virus, but it may transmit the virus to the kitten while it was pregnant. The kittens may be positive and the mother may be negative. And if we assume that the mother is negative, well, the kittens are going to be negative. So we need to test everybody just to make sure. It is recommended to test the mother and kitten separately to get an accurate results. And again, a negative doesn't mean that the entire litter is negative. So we need to keep that in mind. There are three groups of these cats. Those that are persistently infected. From 30% of the cats that get in contact with the leukemia virus, 30% will get the disease no matter what. And those are the ones that get the secondary viremia, when the virus can reach to the bone marrow. Then there is no return. And we have the regressor. 60% of them will clear the disease. And I will be explaining in how much time and how. And the other 10%, we call them atypical because they have the virus in the blood, but if you run an IFA test, it will be negative. So up to a year, it's not decided if they are going to go to be the regressor or to be the persistently infected. So some of them, it will take up to a year to choose where they want to go. Any questions so far? Okay. Look at this chart very carefully. This is when the animal was exposed, or the cat was exposed. So if you run the SNAP test, which is the one that we know, for the first 60 days, it's going to be negative, okay? Because it takes up to 60 days for the virus to replicate in the blood. First, it will start replicating in the blood. It takes up to 60 days. After the 2 months, then the same test, it can be positive. You see this line? I don't know if everybody's able to see it. The regressors, what time they can regress the disease? And the 4 months since they acquired the disease. The first 60 days to here, and then we have the other 60 days. If you look at this test, the IFI results, it will be negative for the first 4 months. And if the cat gets the infection or the secondary viremia, then after the 4 months, it's going to be testing positive, and it will be positive the rest of its life. Versus in the SNAP test, it has up to 4 months to clear the disease. And that will be the group that is in the 60%. Does that make sense to you? Okay, can cats still clear the disease? Yes. And again, we have this blue line here. It can clear up to here. After the 4 months, it's not able to clear the disease. Any questions?
Yes. If a cat is exposed to it once, and they're exposed to it again, and they're one of the cats who cleared it, can you assume that they'll clear it again, or?
That is a good question. Yeah, you cannot assume. You have to wait and you have to retest it. And here is when the retesting comes, or the confirmatory test. Very important to have this confirmatory test, because you may test a cat that is from here to here in this window, and it may be positive, and then you make a decision, you may destroy the cat. And it's like, well, this is leukemia positive. We don't know. A confirmatory test, if you don't know any history of the cat, will be if you want to spend a little bit more money doing this test. And if this test comes positive, there is no return. It will be positive. Now, it can still be in this one, and it can clear the disease. So this is very unpredictable. How much a test cost? The SNAP test between $10 and $20. I don't know how much this to the shelters. So And this other test is around $30, and this one has to be sent to the lab, somewhere in there. So yes, it's an investment that you need to do. So would be a good idea if they were found, so I don't know what the protocols are, but just to confirm, remember that 60% of them will clear the disease. They are the regressors, and we don't know it. And most of the time what we do, oh, leukemia positive, that's it, buddy. We need to be aware of all those things. Any other questions?
Does the IFA test specifically test for the type of leukemia, the 3 different types?
Mhm.
It does?
Yes, it does, for any of those. As long as it's in the bone marrow, it will fluorescent those cells on the bone marrow, and this one is positive. How to manage? Very similar to the FIV. Cats should be confined indoors, spay or neuter so they won't be spreading the disease. Should be fed in a balanced diet so we can boost the immune system. Some supplements, like you say, the holistic. Wellness visit to a veterinarian at least every 6 months. And actually an accurate documentation of cats' weight, because sometimes they start losing weight and we don't know why. Remember that most of the time they don't show any symptoms until they are very sick. So some documentation. And I want to give some summary about between the two of them. The virus, remember that 2 of them belong to the retrovirus. The FIV is a lentivirus, which is a slow one, and the leukemia is an oncovirus, which is developed cancer. Risk group of the population. FIV, the middle-aged cats or other cats are more susceptible to the disease, and the leukemia, young cats, multiple cat households, and free runners. Transmission, FIV, bites, we know. Leukemia, close contact, and from mother to kittens. Prevalence, they are very similar. Clinical healthy cats, 2 or 3% of the population, and both of them in clinical ill, 13, 15, somewhere in there. Immunosuppression, both of them, they cause immunosuppression. The diagnosis, again, FIV by an antibody, leukemia by an antigen. Prophylaxis, yeah, now it's only in the United States. Like I say, I never done any vaccine to a cat for the same reason. I did some research and it can protect from 20% up to 80%. We don't know how much it's going to protect, so. And the burden of having a positive cat is like, man. So, vaccination and leukemia. I did not talk about vaccinations, but if you have some questions about vaccines, I'll tell you about vaccines too. Prognosis, not shorter life expectancy and FIV. And leukemia, 85% of them, they will die between 3 and 5 years with the leukemia. The symptoms are similar: immune system, bad mouth, secondary infections, tumors. There is a very nice video on YouTube if you want to watch it. That will be nice. I would recommend you to watch. And it's the leukemia virus testing in animal shelters. It's like 17 minutes. It's a great information in there if you want to go and watch that.